Hello, and welcome to the Full Circle Healing Podcast, where we merge modern, cutting-edge science with traditional wisdom and everything in between to help you come full circle, back to your original, natural state of health and well-being. I'm your host, Michael, and over the past 15 years, I've helped hundreds of thousands of people find the information, practices, tools, resources, and experts they need to find their way back to optimal health. Our guest in this episode is our friend and leader in the field of functional dentistry, Dr. Mark Burhenne. Dr. Mark is a dentist, founder of Fygg Toothpaste, and creator of Ask the Dentist and the Functional Dentistry Directory. He is a family dentist focused on functional dentistry and preventative healthcare with patients who come to him from all over the world, and he's a leading advocate for a patient-centered whole health approach to dentistry. In this very important episode, you will learn all about the emerging science of the oral microbiome and how it contributes in a huge way to your overall state of health or disease, how you can test your oral microbiome, and what you can do to optimize it. So you'll also learn how dentistry became separated from the rest of medicine and why we need to bridge that divide in order to see our health in a complete way. We'll hear about the very real problem of dental trauma and phobias, of which I have, the role of dentists to reduce this, and how it creates a vicious cycle of oral health problems over the long run. And we'll learn about what common practices and products destroy the oral microbiome and what you can do to take good care of yours, and a lot more. Dr. Mark's an incredible educator, very good speaker. He knows his stuff, and he produces some of the most highly valuable educational content on this subject anywhere in the world. So functional dentistry is a huge missing link for many people who struggle with complex chronic health problems because, like I said, we look at it as separate, the mouth and the body, which is ridiculous. And it's a topic that needs to get talked about much, much more. So let's dive in with Dr. Mark. Hey, Dr. Mark, welcome to the podcast.
Good to see you again, Michael. Thanks for having me back.
Yeah, it's going to be fun. I've been excited. When I saw this one on the calendar, we had a lot of fun recording an interview for a summit last year. And for someone who's not a functional dentist, functional dentistry and what I would call real dentistry is a topic I love talking to people about and learning more about and introducing the audience to, because I feel like it's so important. And I think it's one of those big kind of missing pieces to a lot of people's puzzle, which is what we're kind of trying to do with this show, is help people find their missing piece. So this is a big one. If you're out there and you have some form of chronic disease or chronic symptoms that you may think is completely unrelated to your mouth, you're going to learn why that might not be true. So let's start with functional dentistry as a term, as a thing. You've started a functional dentist directory, which is a great service to the world, because that was my first problem when I started learning about this. Is I read something in a book and was like, great, I'm going to go to a guy who does this or a woman who does this. And then it was like, how do I find them and what do I type into the Google? So what is functional dentistry and what do dentists that you're listing on that directory, like how do you choose them?
Right. Great question. I can answer that many different ways, but let me answer it this way in regards to what you just said about oral health being a big part of the puzzle, sometimes the biggest part of the puzzle, but unbeknownst to the patient, even their conventional dentist. What a functional dentist does is they make that connection. I mean, to put it very simply, they look at the big picture, they connect oral health to systemic health. And the connection between the two is just getting bigger and bigger every day. As the research comes out, we realize that there is this connection. And again, to even be talking about a connection, the connection has always been there. The mouth is part of the body. And it's funny that we have to now retroactively start talking, and I've been talking about this for 15 years at least, this schism between the medical world, the dental world, which is a great metaphor for how we think of the mouth as a separate part of the body or a disconnected part of the body when it's actually the opening and beginning of the alimentary tract. It It's connected to the gut microbiome. I mean, and has many systemic effects, good and bad, depending on the condition of the mouth. So that's one definition. The other definition is a little bit more conventional, and you've heard it in functional medicine as being described as someone a provider, healthcare provider, in this case, a dentist who has training in oral health diseases and treating them, hard and soft tissues. They work upstream of the symptoms. And I know that's become a little bit of a overused analogy, but it really works very, very well. If you're working, in a river system, why would you work at the bottom of the river where all the crap gets dumped out and you start seeing all the issues that are happening upstream? Why wouldn't you take a trip upstream, however you can get there, or spend time there, or communicate with someone who's there giving you the information of this is why you're seeing what's going on at the bottom of the stream or river, flashes of the music, the Moldau. Do you know that by Smetana? That's flashing in my mind now because it's this wonderful symphony of, from the very beginning of a river down to the blue Danube, and it's a beautiful journey. So that's what a functional dentist does. That's what a functional provider does. They look at the stuff that causes the symptoms, and then by knowing what is causing the symptoms, they can prevent that disease from occurring. And that simply is referred to in the medical world as treating in the prodromal phase of disease. And when a patient hears that, they're like, God, that makes sense. And I don't want to get the disease. And I don't want to
pay. Like proactive versus reactive kind of. Yeah.
And it's like no brainer, but that's how dentistry is working. That's how medicine is working. In the US, in Europe, and it just doesn't make sense. But that's how we're trained. And to be fair,
when that happened. Do you know the history of when that? Because you mentioned it, and I started to think if you go back far enough, there has to be a point where the mouth. And I was trying to think, what other parts of the body do we also isolate out of the body? And it's the eyes. There's eye doctors and there's eye medical insurance for vision. Like, my health insurance includes dental and vision. It's really good. And it's like, in what planet should it not include that? And I've seen a sly meme lately that said, isn't it strange we have separate insurance for the bones in our mouth versus the bones
in our body,
in our arms and our leg? Like it's this funny thing. I have bones in my mouth and I need separate insurance for them. So when did that happen? Do you know?
So that's a great question. In the U.S., it happened in 1839. Dentists got kicked out of a club, and it was a club of practitioners, and medicine and dentistry were part of the same club. And, dentistry was helping medicine with general and local anesthesia. We were the leaders in that field, and they needed that. And, physicians had toothaches. They needed us. And so we were all doing well together and considering ourselves as, the practitioners for health. And then it became political, and then physicians thought we were not as evidence-based as we should have been. Then there's some truth to that. We were working on hard tissues, inanimate objects, the teeth, and they started looking at dentistry as just tooth carpenters, literally, because we were making dentures for George Washington, out of ivory, right? So again, there's a lot of truth to some of this, but that division has really hurt the patient in the U.S. And dividing the two from one another. But that's all changing now. We still have separate insurance products. I wouldn't call dental insurance. It's more of a kind of a service because it doesn't fully cover you. If you get into a car accident and knock out a lot of teeth, you're not covered like you are with medical insurance. Medical insurance will patch you up, but not the teeth. So, but this is changing. And when people seek out functional providers, they understand the connection and they pay beyond their insurance. They realize that their insurance product, the dental insurance product they have, is inadequate and dysfunctional. And I think one day we will see
similar to the health insurance
product. Yeah.
That's really fascinating. I didn't expect an exact year date when I asked when that deviated, but that's an interesting story and an interesting history. And I had a feeling you'd be the one who knows. Yeah,
That's the
yeah,
short
yeah.
version of the story. There's a book on it, and I read it with great fascination, and it's well researched. So, yeah.
It's been such a massive disservice because, as we're going to talk about here, and we could just jump into it, how oral health problems, and I learned about this firsthand because I developed an infected root canal tooth about now probably 11, 12 years ago. And all of a sudden my tooth started hurting and it was weird and it smelled and it was right when I was getting into functional medicine type information, and somebody mentioned to me that's probably infected, you should get that pulled, you shouldn't have those in your mouth. And I'm like, why? And they gave me some book, and I don't remember what the book was, but it had that famous picture with the smoking mercury from the teeth on it, and it talked, and I was reading about root canals and how the bacteria that can fester inside of a root canal tooth can then go into the bloodstream potentially or get into the local area. And I went down the Weston Price rabbit hole, and so I found out about it firsthand, but I think a lot of people don't realize this. So how does, and this could be 6 hours or 60 hours of conversation, but some big heavy hitters of how oral health or disease in the mouth and conventional dental, I'll put them in quotes, solutions to oral health problems, both of those, both the problems themselves and conventional solutions, can contribute to systemic health problems. And you mentioned a few before we turned on the cameras, and there's some big hitters. I think we could just stick high level with this because this could go as far as you
definitely.
want.
Let's keep it real simple. It's a great question. Unfortunately, there's a lot that a dentist can do, in treatment that can take you out big time. Autoimmune diseases, death from sepsis, and everything in between. Just low quality of life, lots of little acute and chronic diseases that exhibit themselves or don't exhibit themselves, and you're not sure why you have an elevated CRP or level of inflammation in your body. It could lead to mental illness, mental health issues, brain fog, a host of issues. And the two big ones are root canals and extractions. Wisdom teeth extractions can be any extraction. Wisdom teeth extractions tend to do more about what I'm about to describe. But so these techniques, if done extremely well, are typically okay. There's some caveats with root canals, but an extraction has to be done well. When the tooth gets taken out, let's say it's a simple extraction, the socket has to be curetted. There's a lining of tissue that's left behind if the surgeon is not careful. These days, standard of care is a bone graft, filling that area in, spinning in some of the patient's blood, growth factor, so that the bone can grow back in and fill in that part of the jawbone. And what happens typically, and the question is how often does this happen? And I can get into that if you want, because there are a lot of practitioners that are overstating the case, but it can happen. So as simple as a tooth extraction, it can be a simple tooth extraction. It can be a very complicated one where the tooth is sectioned and has to be removed with a drill and other bone removal. When the tooth comes out and the body tries to heal that cavity, hence the word cavitation, and that's the lay term still. Cavitation is still a lay term. It's really called, there are many names for it, but one would be fatty degenerative osteonecrosis or osteolysis of the jawbone. And what that means or implies is that over time, you get this little cave or this little gap or hole in your jawbone. And guess what goes into that part of the jawbone? There's no immune system. There's no blood flow. There's no bone density. It's an open space. Everything that can go wrong or is toxic ends up collecting in that area. And that has to be removed. And if it's not removed, the body senses that. It sends, macrophages and, all these, star troopers of the immune system there, and you get inflammation. And unfortunately, and this may sound weird, but unfortunately, sometimes it's not painful. Most often it's not painful. So you don't know it's there. So it is called a hidden source for oral complications and disease. Your jaw can break because they can get quite large, but it also seeds the rest of the systemic part of your body. This stuff gets into the blood supply, these toxins. and it can literally take you out. It can cause other diseases. It can cause Alzheimer's. I use the word cause there, just to be very clear. It is a causative agent in some cases. We're beginning to see that in studies. They're discussing the notion that bugs in the mouth can be the cause, not singular cause, but multifactorial, but can be causative in inflammation of the brain. And that's just one example. These bugs get into your joint spaces, rheumatoid arthritis. That's an autoimmune disease, other autoimmune diseases, even cancers in certain fatty tissues, like breast cancer. Likely, I think, based on what I'm seeing with my patients, is prostate cancer as well. So root canals are the same. Let's not forget that. A poorly done root canal starts leaking right away, and the bacteria will aren't removed to begin with, or they will seep back in, and the immune system surrounds that tooth, and you get the same kind of reaction as you experienced. Sometimes the tooth will crack and break. That also causes that sepsis to form around the tooth. Sepsis is not the exact correct term, but it gives people an idea of what happens there. But that tooth has to be removed. Root canals in some circles of dentistry now are considered now a temporary treatment. Patients in a lot of pain. They may not be a good candidate for a surgical extraction. There needs to be some prep work done, like with diet, with other like medications. Maybe they're on a blood thinner. So you can't have an emergency extraction done. So you do the root canal that gets the patient out of pain, and then 2, 3, 4, 5 years down the road, you come up with a more concrete, safer, cleaner replacement for that tooth, and that would be a zirconia implant. But there are many people out there, and this is where it's the gray area. A lot of these surgeons that, by the way, make a lot of money fixing cavitations and pulling out root canals and putting in zirconia implants by scaring you into the notion that all your problems that you're experiencing are related to your teeth. And I'm not saying that's not true, but it gets to be a little bit fear-mongering, and those dentists are making a lot more money than the general dentist, and it's easy money. Now, that's not to say that it's not a necessary thing to do, but before anyone starts thinking, oh, I've got chronic neck pain, this is why it's related to that root canal I have on this side, go see someone that is an expert in this area. This refers back to the functional directory list. I can give you more organizations maybe and numbers if you want for show notes, but and make sure that you come in with all your blood tests so that surgeon, oral surgeon or dentist can look at that and then start planning it from there, and get a good 3-dimensional X-ray and go slowly and make sure and come in with low expectations, but address it. If you do have a true cavitation or you have a root canal like you did, Michael, that was infected, obviously you knew you had to, and you were lucky. You were lucky that you had symptoms. Imagine if you didn't have symptoms and you lived for another 20, 30 years with that, what would that have looked like? It's not great. And sometimes it can lead to irreversible systemic diseases, scarring of the heart tissue and the myelin sheath deposition in the brain. I mean, some of that may be reversible according to some, but so yeah, these are the problems in dentistry. Poor dentistry and certain methods of treatment can lead to severe consequences in the mouth and also in the body. And it's a minefield, and I would be careful who you see, and I would go slowly and just get the facts, read the research. But this is a very important part of dentistry, unfortunately.
Yeah, that's a lot of serious correlations and connections and causations that are being discovered there, and it makes total sense if you really understand what's going on. And you did a great job of explaining that. And yeah, I had symptoms, and I remember something I'll never forget is when they were taking out that root canal tooth. I was pretty heavily sedated because which is something else I want to bring up, is dental trauma. I have a lot of dental trauma. So for me to have a procedure done like that, I need to get pretty wasted, or else there's no one going anywhere near my mouth with any of those things that are required to remove those teeth. And as intoxicated as I was, the smell that I smelled when they were taking out that tooth is unlike anything I think I've ever smelled since, before, after. And I don't know how to describe it, but it's bad. Like it's all things with scent are averse to certain smells. Like there's things that you smell, feces, rotting flesh, like stuff that is really, really bad for you to consume or be near. We have like an evolutionary aversion to it. And so do animals, so does everything else. And whatever was in my tooth triggered that. Because I remember trying to like mouth holy shit while I had all the things in my mouth. And then later the assistant was asking me what I was trying to say. And I said, I don't remember, but it was something during the smell. I said it was the smell. And she goes, you kept saying holy shit. And I was like, yeah, it's the smell. So I was sold. I was like, that has to go. And the other one, I had another one in my mouth that was done by the same dentist at the same time. I said, we're taking this one out as soon as I recover from this one. And then I had holes, and now I have the zirconia implant that I had done here, which is a whole nother procedure. But
so imagine this though, Michael. I mean, you bring up a really good point, and it's a good point because it really describes what's going on in the jawbone. So you smelled it, and this is a problem in dentistry. I've had some dental assistants fall out of the chair, and of course they're the ones holding the suction tip. So we grab the suction tip and keep it on there because you don't want that floating around in the mouth. You want to keep pulling it out, and the smell. But add to that the sight or the view of this. And it's funny because every time I would open up a cavitation or remove a infected tooth or an infected root canal tooth, there would be different smells, different colors. The exudate, I don't want to gross anyone out, but the pus and the liquid and the consistency of it would all vary from person to person. But add to that, to the smell, the
smell is enough for me.
And it's every time you do it as a dentist, you feel gratification, instant gratification, along with horror and terror.
The hell out of somebody's mouth.
You've just done such a great service, and it's walled off. I mean, and think of what the body has to go through to deal with that as well. So anyway, I'm glad you brought that up.
Wow. This smelled like it would have been green.
Yeah,
but I don't.
Green, brown, reddish,
like a greenish brown kind of sludgy color is what I'm imagining. But okay, so that's what can happen from conventional dentistry care. I want to mention. Oh, and I know I only am going to bring this up for a second. This could be a whole nother episode because I've seen you post on this on Instagram and acknowledge it. And one other functional dentist I talked to, we interviewed a while back, acknowledged this as well. And I love hearing it because my own personal focus and work right now is predominantly in trauma work and somatic therapy and emotional healing. And I have 9 out of 10 level dental phobia fear. Like I have to be heavily sedated. I would die if somebody tried to extract a tooth and I wasn't under sedation. Like I would have a full panic attack. My body would shut down and I would not. And I had a lot of dental work done as a kid. It was really not a good experience every time. I used to stay up at night the night before, dreading going there. When something was wrong in my mouth, I would start to have panic attacks because I knew where I was going. I knew what was going to happen. And this is not uncommon. Maybe the level to which I have it maybe is extreme, but it's not uncommon. And I love your posts on it because you acknowledge it and you talk about how dentistry needs to let's stop doing this to people so that they'll come to see us more. Because as an adult, I went to a dentist for a cleaning. I hadn't been in 6 years. And she said, why haven't you been to the dentist in 6 years? Your teeth look atrocious. I said, because I'm literally terrified to be here.
Right. And it gets worse from there. So we create the dental phobe with bad experience, typically as a young person. This is the simplified kind of course of how it happens. And I'm a little bit in that boat too. I can tell you some stories when I was a kid, and I shouldn't remember the name of my pediatric dentist when I was 6 years old, but for some reason I remember. Yeah, exactly. It just gets burned in your mind. You can see the sign, you can see the toy drawer, I can see the dental chair. And this was in San Francisco. It was very well-known dentist right across from the Children's Hospital on California Street. I won't mention any names. I don't think he's in practice anymore. But so you get those early experiences, you start dreading it. The experiences can be a lot worse than that in your teen years. And then you stay away for a while and you can make lots of excuses. I can't afford it. I'm in college. I lost my dental insurance, et cetera. And then you go back and then you get shamed for not coming back. So it's even worse. It's shame on top of fear and anxiety.
On top of the new problems you now have because you haven't been there in 10 years.
Yeah. And then sometimes the patient won't come back again after that. Maybe it's not about
I did
the
that.
anxiety.
I did about many year, a cleaning, and then another many year until it forced me to go there because I couldn't eat food.
So then it's not about anxiety. Then it's about shame. Shame is just as bad. When you're shameful, you don't want to bring up that emotion again. So you're going to stay away. And anyway, I'm glad you bring it up. I don't know which post you're referring to because we post about it often. You really, your dentist needs to be accommodating, understanding, emotionally available, someone who understands or is in the same boat as you are. I know a lot of dentists that are phobic. I've gotten over my phobia, but it's not an easy kind of thing for me. If I had to have a tooth extraction, I mean, I know too much. I mean, but anyway, there are a lot of ways.
Don't
around
fill my
it.
head with any of that. Let's let that. I don't need. I don't want to know any more about that.
Right. Yeah. But the dentists have gotten better at anesthesia and semi and full conscious sedation. If you do find a dentist that offers full conscious sedation, make sure that it's being done by an anesthesiologist that's brought into the office. I would recommend that because you can have, again, in the medical world, the surgeon who's doing the surgery is not doing the
they don't have anything to do with that.
Right? So why would that be okay in dentistry? I mean, let the surgeon focus on what he's focusing on and have someone else be monitoring vital signs and breathing and all of that, and also doing a good job of titrating whatever agent is necessary to get you in a comfortable place. Anyway, that's just a pet peeve of mine. So this is a real problem. This probably is keeping, I would say, 40% of the population from seeing a dentist on a regular basis. And when they do see a dentist, they're in so much pain that they have no choice, or their face is literally out to here. They can't go to work, and they end up in an emergency
more
room.
negative connotation. Like that's another negative experience. You're setting yourself up for. Yeah. I only go in here when something horrible is happening, and then your brain is like, that place is horrible.
It's a real problem. It's a real problem. And I think dentists would be a lot busier if they could, tap that 40% and bring them in and make them happy and please them. And there's a lot of dental work there that is not being done. And so anyway, I think it's a great topic. I'm glad you're able to talk about it. It needs to be talked about more. And we need to take some of the responsibility, if not all of the responsibility, for a patient like you. And that's the first step.
It's really nice to hear. And I hope that catches on. And I also remember my dentist's name from when I was 6. I remember what my reflection looked like in his glasses.
Yes.
And I remember what the pores on his face looked like.
Right.
So this stuff gets etched in somewhere deep in there. So
my dentist was shaming me while he was drilling on me without anesthesia, just a little nitrous, which doesn't kill pain. It just alters your perception.
Yeah,
of
it just
anxiety.
makes you a little less terrified of it.
Yeah, maybe. Sometimes it can heighten things. But he was telling the assistant as I was in the chair and he was drilling that this young boy has such a small mouth. It's like, well, sorry.
Let me make my mouth bigger. That's a whole nother topic we could talk about too, is how orthodontistry and moving teeth instead of working on changing the way our mouth is structured and our airways develop. But that's a whole nother. But way to go, Doc. Way to shame a 6-year-old kid.
Anyway.
So I want to get to the topic at hand here before we're done. Is we talked about conventional dentist treatments that can lead to a lot of problems. We talked about phobia, fear, shaming. I want to talk about a topic that our audience knows quite a bit about in regards to the gut, but probably less when it comes to the mouth. And this is the microbiome, the oral microbiome. And I think that a good overview talk here would do a lot of people good to really understand that it's not just the gut microbiome that's having a huge impact on our health, and that maybe that actually even starts, like you mentioned, I liked your analogy of the river. How does anything get into the gut? Unless you're doing something super invasive, it's going to go through the mouth.
Right. Well, I mean, so here's the story. You're talking about the oral microbiome, and this is probably the pillar now of dentistry, or should be. It's not in all circles, unfortunately. Based on the latest research, and the research is maybe less than 20 years old, so it's going to take a while to get into the curriculum. The oral microbiome is the second largest in the body. It is the most diverse. We can talk about why, location, basically, and function. And these bugs in the mouth, there are over 700 species. More, actually, we're almost up to 800, actually. 700 is the last week's answer. So these bugs are crucial for oral health, certainly, and have downstream effects in many different ways. One is by swallowing the bugs. We swallow 1.3 to 1.5 billion bugs every day in saliva. We swallow about 1.5 liters of saliva. Every swallow, not a beverage necessarily, but when you swallow saliva, which is, you want to swallow saliva. It helps lubricate things, but it also gets those bugs to the gut. So that's one way. You can also get bugs to the rest of the body via the bloodstream. And a lot of people ask, well, how is that possible? Isn't the mouth kind of a closed system? And it's not. A lot of practitioners talk about leaky gut. There is leaky gums. I'm not crazy about that analogy because it's a different mechanism, mostly. But the mouth can be leaky, and these bugs, without cutting yourself or without a wound in your mouth, can get into the bloodstream. And hence they can get past the blood-brain barrier, past the placental barrier. They can get to wherever there's blood, you can get oral pathogens. And in fact, if you look at 7 out of the 10 major chronic diseases systemically, cardiovascular, neurological diseases, et cetera, 7 out of 10, depending on how you categorize it and define it, of those diseases involve an oral bacterium. And the question is what's that oral bug doing there? These are, again, because of the diversity of the mouth, we've got some unique bugs in the mouth that really don't show up elsewhere unless there is signs of disease or inflammation. And this is why the oral microbiome is so important. This is why you need to see a dentist that addresses and knows of and accepts the theory of treating and nourishing and protecting, and sometimes just leaving it alone and letting it do its job, and that is that of the oral microbiome. And I think a lot of physicians, neurologists, endocrinologists, they have come to the same conclusion that you've got to address the gut microbiome when you're dealing with cardiovascular disease and SIBO, intestinal diseases, all of that, even cancer of the colon, all of that. So there is a Fusobacterium that is found from the mouth that is associated with and found in colon cancer. In young people, actually, they're finding that now. And that's one of the explanations, perhaps, they think, of why this is on the rise in young people, colon cancer. And so the oral microbiome is key. It needs to be discussed. We could do a 7-part series on the oral microbiome. It's that
don't
important.
say that because I'll try to drag you into it. So
I've done one. I've done 2 of them. So with other influencers, and it's worthwhile. And the problem is that they're already outdated. Those series, they're already outdated because the data and the types that the bugs coming in and it's all coming in so fast. And so that's very exciting if you're a dentist, if you know about and accept that the oral microbiome is really explaining everything that we didn't have an explanation for, or we used a different explanation and that explanation's wrong. The mechanism is...
And it's easier to test. It's much easier, and we'll talk about that in a second, but stool testing has a ton of different problems with it and difficulties with it, and we don't have to get into those, but it's so much easier to test effectively, I would guess, what bugs are in the mouth. It's much easier to get them out, to test them, culture them, all of that. There's probably an interesting mix of aerobic, anaerobic bugs because there's oxygen in the mouth where most of the gut, there's no oxygen. But if there is, then there's other bugs and it's a problem. But this is a lot more straightforward kind of. The environment's almost always quite similar. But you mentioned that the bugs can get into the bloodstream or leaky. And I think that, I've read quite a few rather convincing and terrifying things about bleeding gums and like gingivitis and risk factor multiplier for cardiovascular events and all kinds of things if your gums are bleeding. Is that one major way that bugs can get from, if somebody they bleed every time they brush their teeth?
So that is a common way. So if you spit out blood after brushing and flossing, which, by the way, is not normal, that means you have typically a chronic, you could have an acute event, but you have chronic inflammation of the gums. When that happens, the morphology of that outer layer of tissue, which is one cell thick, becomes more permeable. And the bacteria that probably are causing the inflammation, it could be a P. gingivalis bug. That bug shouldn't be that predominant or dominant in this case. And because there's an oral microbiome dysbiosis, this is just one example. It's way more complicated than this. Then that bug is able to just go right through that tissue. And on the other side is this massive capillary bed. Very fine, very small, delicate, very thin walls, and it literally gets right into the blood. It can also get back. These bugs can also get into the systemic space outside of the blood vessel, but inside the body, and that is past the periodontal ligament. There's necrosis of the gum tissue. It pulls away from the tooth. The pockets get deeper. This is why we measure pockets. And it's an indirect way of measuring inflammation. That downward growth and loss of collagenous attachment of the gums to the tooth, that allows those bugs, which is in that pocket, which is a very anaerobic environment. And the deeper it gets, the more anaerobic it becomes because it's further away from saliva, which has oxygen in it. All those bugs get inside the body, into the peritoneum, into the lining of the heart. They travel down these spaces. We have names for these spaces, and they're connected. So the mouth is directly connected via just spaces to the lining of the heart, for example. So there are many different mechanisms into the blood, past the blood-brain barrier. You can transpose these bugs in so many different ways, even via the gut.
It's fascinating and a little terrifying, but it makes a lot of sense. And I want to get into, I know we have to go pretty soon. I just want to get into a little bit around what harms or damages or I guess cultivates the wrong biome in the mouth that you don't want. Like what leads to, and I don't like using these terms, but I'm gonna for this conversation, what leads to more bad bugs, less good bugs? And then after that, I'm going to ask you how to flip that or switch that, or what does a good oral microbiome want or like?
Right. I mean, we can talk all day about how things go wrong in the mouth, but if we don't offer solutions, then we haven't accomplished much. And just as a reminder, I mean, the oral microbiome, when the oral microbiome is not well, if there's a dysbiosis, that's the term we use, or it's just not working well, and these colonies of bugs are all over the place and are not working well together, or there are certain bugs that are bullying the other bugs, that's a dysbiosis. This is a metabolic disease enhancer or amplifier. So metabolic disease would be BMI, blood pressure, triglycerides, and your A1C and fasting blood glucose. Those are all the markers of a metabolic diseases. And a problem in the mouth, an oral microbiome dysbiosis, enhances all of that. So that's a big statement, but keep that in mind that a little bleeding in the mouth will enhance metabolic diseases. Big deal. So what do you do about that? Well, first of all, don't do any bad dentistry. Don't take your dentist's advice. It depends on your dentist. I mean, I'm being facetious to a point here, but certain advice you're getting from a dentist, like, oh, rinse with Listerine or with chlorhexidine, because that will kill all the bugs. Well, guess what? Your blood pressure will go up. You're killing the bugs in the back of your tongue that produce nitric oxide. But if your dentist tells you to tongue scrape, stay away from the mouthwash, that's good advice. That leads you to a commensal oral microbiome. So who your dentist is a big factor. Make sure they're well trained. Again, the functional directory. Also make sure that you're using the right products, oral care products. There are so many oral care products. I just listed one that can cause disease and cardiovascular disease, and inflammation, insulin resistance. Listerine, is an example of that. So be careful what you're using. Make sure you are using, in a nutshell, that would be make sure you're using oral microbiome friendly products. 99% of the products out there are the opposite of that. So that is very, very important. And then the last thing, of course, and these are the three big things that help the oral microbiome, is your environment, your diet. Diet is so important. I mean, I listened to a podcast the other day. It was very interesting. It was a expert on sugar. And, you know, dentists like to blame the patient for cavities and bleeding and bad breath because you're eating the wrong food. Shame on you. And then you're not flossing and brushing enough. So if you're going to eat those bad foods, start brushing and flossing more. But when do we start blaming big food? I mean, they're putting so much crap on the market that we really don't have a choice on what to eat. I mean, we do have a choice, but it's hard. It's getting harder. And this is the problem with diabetes. Fructose, when they invented fructose and put that into everything and took out other simpler, older sugars, fructose actually turns on the fat gene and makes us very unhealthy. So it's the same thing in dentistry. Our environment and the corporations that are contributing to that, our terroir, I live in Napa Valley, so I would refer to it as the terroir, it's dysfunctional. So let's give them some of the blame for an oral microbiome dysbiosis that leads to Alzheimer's or a cardiovascular event.
So you're talking about highly processed foods, high in processed sugars, like that's what tends to feed the bugs.
Yeah, that food was never in our food supply to begin with. What's it doing here? I mean, it appeared, it's here, it's been here for 100 years, it's getting worse, it's becoming even more profitable. Here we are. And so those are the three things. I get evangelical sometimes, sorry. So it's the foods you eat. Make sure they're oral microbiome friendly. Make sure the oral care products that you're using are oral microbiome friendly. And lastly, make sure your dentist and your hygienist is oral microbiome friendly. That's all you need to know. Those three things as they apply to the oral microbiome. And then you're set. And then not only will you have good oral health and you'll need less dental work or no dental work, you'll be better off systemically, health-wise. Less inflammation, less autoimmune diseases and complications. It'll be easier to lose weight, less chance of getting cancer and Alzheimer's. I mean, the list goes on.
Yeah, there's no reason not to do it. So before we go, you mentioned oral microbiome friendly products. You've had a large part in creating a toothpaste. It's pronounced Fygg. Yeah, I've never heard it said out loud. I've only seen it typed, but it's spelled a little differently, but I'm guessing it's pronounced Fygg.
Yes.
And this is an oral microbiome friendly toothpaste. Mm-hmm. And so we'll put a link in the show notes for that. If you want to talk about that for a second, that's great. If we want to leave it at it's an oral microbiome friendly toothpaste that you helped create, we can leave it at that. But if you want to say anything else, you're welcome to. And then
that's all you need to know. Use the right products. It's a game changer. It's taking the right step forward. And by using these oral microbiome friendly products, you've replaced it with something that did the opposite. It's a huge jump.
It's a double flip. And your website, Ask the Dentist, you have an oodle of product recommendations, and there's a whole page I was scrolling through, and I was like, man, where the hell was this when I needed it? And it's so helpful because it's overwhelming to try to flip all these things. So he's got on his website a ton of product recommendations. You mentioned the tongue scraper. I like hearing you mention that because it's the thing that I'm always curious about, hype or real. And then I have one in the bathroom that now I'm going to use more because you said it. But
it's real.
Great. And takes 2 seconds. It doesn't hurt anything, and it's fine. Mm-hmm. At first, I was scared of it because it's metal and it was going in my mouth. But
yeah, exactly.
I'm over
and gag reflexes, and
I'm over that one.
You're right.
And then just basically eting real food. I'm sure I'm oversimplifying it. There's certain things the microbiome would like better than others, but real food,
whole foods. And really, I know a lot of people don't have time for this. And if you don't, you can order this and have it come to the door. But learn to become a good cook. Cook real foods. And eat lots of spices and make it taste really good. Omelets, meat dishes, fish. I've worked now just in the last year on becoming an excellent cook when it comes to fish because I love fish. But
good for you. That's been on my to-do list for about 20 years.
But only when I go to a restaurant because they do such a good job.
Same.
Well, I got a 2-star review from a restaurateur foodie the other night on a piece of salmon. So, that really helps. And then, yes, cooking takes a lot of energy, but when you taste your own food and you see what goes into it, the time flies. It really does. Anyway, but you're right. Good food. Oral microbiome friendly food. Whole foods.
All right. Well, Dr. Mark, thank you so much for sharing all of this. We went a little off track on a couple of things, and I think it was all in a direction that's going to be helpful for people to hear. And it's such a broad topic that has so many different little silos you could jump down that are so important to people to understand that 7-part, I made a note, come back and harass him about a 7-part series. So you're going to hear from me at some point. We're collaborating with Curon, who I mentioned before, to create a microbiome and gut course for laypersons and for practitioners with him. And it's his first ever course creation. So I may come back and harass you into doing some sort of series, because I find this topic, it's like, we just touched the top of the iceberg. Like there's so much more, and anything we can do with this platform to kind of push this out there and cause more consumers to be asking more questions and looking for more dentists, which leads to more dentists learning and it creates this snowball effect. I'm gonna do it. So thank you so much. I always enjoy our conversations. I take more notes when I'm talking to you than pretty much anyone else. I learn a lot from myself, and thank you for acknowledging the fault of the dental world and creating my fear and my phobia. I feel vindicated and validated. So
I'm glad to hear that. That's important. Thanks for having me on the show. I always enjoy it.
Yeah, likewise. And we'll link to the toothpaste down below. Fygg, check that out if you want some microbiome-friendly toothpaste. So thank you, Dr. Mark.
Thank you, Mike.